Would you like to humanize your health center and don't know how? Today I want to share with you the 9 keys that, according to my experience, are basic to succeed in a humanization plan. My name is Albert Cervera, and I have more than 10 years of experience making strategic plans for multinationals, until one day I said I wanted to put all that value to help and improve people's lives, and specifically to make humanization plans for healthcare centers. The first key is to collect things that have already been done. I appreciate the amount of previous studies. There is a lot of material on the whole world of humanization. I assure you it is mind-boggling, especially in countries like the United States or some Nordic countries. But sometimes I dislike knowing that there are so many studies on the subject, so many academics sharing it among themselves, and not much is being done about it. So for me, the number one key is to do a very deep research, to collect as many things as possible, because sometimes being innovative is not only to create new things, but to know how to copy, and you have to know how to copy well. So what I'm getting at, collect, copy, and implement? Key number 2 is to have a powerful participatory process, and I say this for 2 reasons. First, because it is a great source of information, as long as we have a wide variety of people to ask. In this case of hospitals or health centers in general, you have to ask the patient's companions, the patient's associations. You should ask all the healthcare personnel from the different departments you may have, from administration to medical staff, nursing staff, etc. Each and every one of them will be able to give you a different perspective and find the information you need. The key is not to take anything for granted, because many times we are already asking for a result, and that is one of the mistakes of this type of process. And the second reason is that if we want this process to flow properly, the healthcare personnel must feel that they are part of the process, motivated to move it forward. I have seen it in different projects. In some we have been able to involve them, and in others we have not, and I can tell you that it makes a difference. The key to this is to have a very well thought out and agile process, because you all know many participatory processes in which, if there is no order, everyone is giving their opinion and you get nowhere. So participatory but very well articulated and looking for efficiency. Point 3 is to choose a sponsor who is on the board of directors. This figure serves as the guardian of the whole plan, and above all to eliminate those blockages and breaks that arise in this type of process. I assure you that having a sponsor is the difference between a successful or unsuccessful plan. The fourth point is to choose a person to coordinate this whole process, ideally an external person, in order to avoid problems. It has to be someone specialized in this type of process, providing us with experience already acquired in other cases, and they are also very good at managing conflicts and getting the best out of organizations. Point 5 is to adopt a lean startup methodology, which is the one used by the most innovative companies, where instead of looking for the final picture, we start to make trial and error with very agile decisions, and in this way we ensure a better implementation. Point number 6, you have to have a vision that is not inbred. The healthcare sector is well known for having a very endogamic vision, which means that only the different healthcare centers are taken into account, and they don't look beyond. But if I have to do research on what is the best way to improve the patient experience, which industry would I look at? You know which one I look at? I look at Disney. A lot of people don't imagine. Disney is one of the companies that best manages the experience of what they call the guests in their theme parks. So they are an example perfect of how important it is to look at other sectors, to bring from there the best practices that can be used and improved in this humanization plan. Point number 7 is funding. That is the great enemy of this type of project. But if instead of seeing it as an enemy, we include it from minute zero of the plan, and we start to think and proactively look for organizations, both public and private, that can be aligned with the objectives of our humanization plan. We make sure that we have the financing for the whole process from the beginning. Point number 8 is to make a very powerful communication, both internal and external, and very well planned. This allows us to distill all this DNA that we are transforming so that it reaches all healthcare personnel. We also have to ensure that all the efforts we are making reach the different public agents. To do this, I recommend carrying out very powerful communication actions. For example, emotional participation videos work very well for me. And also, if you have research staff, it is very interesting that it can be measured and quantified, generating scientific evidence, and that with this we can end up generating publications. And now we have reached the last point. which is by no means mandatory, but I can assure you that in my experience it has given me incredible results. And that is to take key meetings with the steering committee out of the comfort zone in their offices and in the health center and into a natural environment. I can assure you that the results of a 2-day session in nature are equivalent in depth to everything we could have had in meetings over a year. And this is as far as this video goes. Thank you very much for your attention, and feel free to leave any questions you may have in the comments.